In complex cases, a delay in healthcare could cause actual harm to the patient.
Before I had my heart attack, I really didn't have any health issues. I was a pretty healthy guy and pretty active, snow skiing and motorcycle riding and racing out in the desert. I had a heart attack on the day that my second son passed away. I had the heart surgery. I didn't have a place to go when I got out of the hospital. I couldn't pay the rent, and that's how I ended up basically being homeless. I had the problem with my heart, which went on for a couple of years, and with that I got hypertension. More recently, I ended up with COPD. The receptionist at my doctor's office mentioned that I could have a phone appointment. I wasn't sure what to make of the situation because so many times you get on the phone and people, put you on hold. You're talking to a machine. This actually did something and accomplished something which surprised me. It made me feel good.
The patients that we see at our health center are persons experiencing homelessness or are transitioning from homelessness. For Kevin's healthcare, phone visits have meant that we could do more frequent visits. He needs a lot of specialty care. He needs a lot of doctor's appointments. Coordination of care then is very important. Phone visits can really help with that.
It's so much more convenient. I'm in downtown LA, everybody's out in the valley. Instead of having to drive to the office and talk to the doctor and wait all this time, I can get on the phone when I talk to him and stuff can be done a lot quicker.
My patients break appointments for numerous reasons. Sometimes it's work, they forget, they have a lack of transportation. A lot of people can't afford internet, they don't have access to a data plan. By calling them, we can connect them easier.
Quite honestly, I'm not a big computer guy or in the internet. I'm pretty old school.
We really need to figure out and allow for us to meet patients where they're at.
For people like me who are experiencing, or I was experiencing, homelessness, it's much easier and much more convenient for somebody to have these phone visits because being homeless, you don't always have a schedule that you can follow and you don't know what you're going to do. Well, my hopes for the future is that I can feel better to where I can start doing the things that I enjoyed doing before. I would like to have my own apartment, be living by myself, a place where I can be fairly near my family and be self-sufficient.